Hello everyone, welcome to 5 Minute Video Study for the NCE. Today we are going to be covering treatment planning and we are in subtopic H, which states discuss termination process and issues. In therapy, it shouldn't be a continuous thing. There should be treatment planning, there should be goal settings, and then within those different stages, right? The initial stage, the working stage, and then kind of the termination phase. Um, there comes a point when terminating therapy process is initiated, and that can either be by the client or by the therapist. And that's kind of where there's a mutual agreement that therapy must end. Termination with the client can certainly be challenging, especially if you don't know what steps to take. So you might ask yourself, how do I tell if they've met their goals? When do you tell them? How long do you take to kind of start that process? When do you terminate therapy with a client? Before you look at the termination, you have to kind of look at what is the client's progress. What are they emotionally ready to be done with therapy? And in the best of circumstances, termination occurs when the client has met their treatment goals and no longer in need of service. But that's not always the case. Not every therapist initiates termination. Sometimes the client is ready to move on. And again, part of our job is to promote autonomy. That's in our ethical code. Other things to consider is that sometimes the client may need a specific type of treatment where the clinician may not offer it, or sometimes the client may need a different level of care, and that can also kind of look at the termination. So all of those are factors. Other things could be relocation, financial challenges, not feeling like the therapist is the right fit, and then opting to end the therapeutic relationship. Part of the clinician's role is to talk about the treatment planning and talking about termination as part of that treatment planning. Part of it to go smoothly is you don't want to end it abruptly. That's kind of the whole notion of empowering autonomy, so that they feel like they no longer require therapy, that they can kind of do it on their own, or they have the support systems to do it on their own. So again, part of the clinician's role is to empower the client so that they don't feel like they have to depend on the therapist. Other things to consider is letting the client know about termination in the therapeutic process. Normalizing those conversations. Um, Again, an open dialogue with the client, and then letting them know that they gain those skills that they were looking for. And then, if possible, scheduling a termination session where you go over the treatment plan, you talk about the progress, you look at those strengths based models, and you empower them and let them know, how far they have come in the therapeutic process. And also, partner with the client to terminate therapy in a way that works for them. What does it look like if they feel like, some of the symptoms might come back in the future? What does it feel like if they're having a rough day and they feel like, they're not making progress? And then finally, it's important to offer resources so that they know that they have other um, opportunities when they feel like they need help, and then leave the door open. Letting them know that If in the future they feel like they have other goals that they want to work on, that, that's certainly an option. And then having those resources so that they don't feel like they've been abruptly terminated.